SARS-CoV-2 is a virus and not a bacteria. Although the two categories of bacteria and viruses are often confused with each other, they are actually quite different. Let's take a closer look. Bacteria and viruses are microorganisms that can cause infections with similar transmission patterns and symptoms. However, treatment of a bacterial infection versus a viral one is somewhat different, as viral infections cannot be treated with antibiotics and bacterial infections cannot be treated with antivirals. It is always important to keep in mind that the misuse of antibiotics can lead to the increasingly more severe problem of antibiotic resistance. Now, let's zoom in onto each specific organism. First up, bacteria. These are single-celled and free-living organisms with the ability to survive either inside a host body or on the outside on their own. They are considered to be prokaryotes and come in different shapes and sizes. They can also be gram-positive or gram-negative, with the gram-negatives being more difficult to kill and more likely to develop resistance. In the case of a bacterial infection, treatment is with antibiotics, but with the increasing prevalence of antibiotic resistance today, antibiotics are often only prescribed for serious bacterial infections, as minor infections can often be dealt with by your immune system. However, not all bacteria are bad, and many are actually quite essential in our daily lives. In humans, beneficial bacteria live on our skin and in our digestive tract, helping with tasks of metabolism, digestion, brain function, and general well-being. In the environment, bacteria help with nitrogen fixation and decomposition of organic materials in the soil. Moving on to viruses. So similar to bacteria, viruses also come in different shapes and sizes, and like bacteria, there are viruses that are both parasitic and beneficial. Unlike bacteria though, viruses are a non-living collection of different types of molecules, with their composition being genetic material surrounded by a protein coat, and sometimes also a layer of fat. SARS-CoV-2 is an example of a virus enveloped with a layer of fat, hence why hand washing with soap and water is important during this pandemic, as soap is able to disrupt the fatty layer and damage the virus. For viruses to survive and reproduce, they require a host. And although they are usually quite specific about the organisms they infect, it is possible for viruses infecting other types of organisms to make a jump into infecting humans down the line. Once a virus enters a living cell, they take over the cellular machinery of the healthy cell and force them to help create new viruses. Viral infections can be treated through symptom management and antivirals. However, for most milder viral infections, just symptom management will be enough. Another excellent option, if available, would be prevention of viral infections before they occur, as that avoids many problems before they can even arise. This prophylaxis is through vaccinations, which we've discussed before in a previous video in this series. Despite all their differences, it is good to keep in mind that bacterial and viral infections are often related as well. A current example is that a sizable percentage of severely ill and hospitalized COVID-19 patients have developed a bacterial infection concurrently. We now turn our attention to SARS-CoV-2, which is the beta coronavirus causing COVID-19. Upon infection by SARS-CoV-2, some common symptoms that present in patients include fever, dry cough, difficulty breathing, chest pain, fatigue, and muscle pain. Other symptoms can include headache, dizziness, abdominal pain, diarrhea, nausea, and vomiting. There is also a possibility of escalation into acute respiratory distress syndrome, which is accompanied by runway inflammatory cytokine response and multi-organ failure. Although symptoms can be mild for one person, it can be severe for others. Additionally, this list of symptoms does not take into account the long-term implications and impact that this disease will have on patients' health into the future. So yes, COVID-19 is really quite a serious disease that puts people's health in danger. In the case of an infection, what happens in our body? Our bodies can respond by mediating inflammation and cellular antiviral activity to inhibit viral replication and spread. But this will prove to be somewhat problematic if the immune response is excessive as it results in further pathogenesis in the host in addition to the already occurring lysis of host cells due to the virus. If this excessive response does occur, it will present as some of the previously mentioned symptoms such as severe pneumonia, fever, and dry cough. It can also progress into acute respiratory distress syndrome and septic shock, and potentially even multiple organ failure and death. So we now know how our body responds, but what are the treatments? At the time of writing for this video, no approved cure is currently available, so no, hydroxychloroquine is not a cure. Although we currently don't have a cure for COVID-19, we are able to manage the disease in the form of symptom management. This may include isolation and supportive care such as oxygen therapy and fluid management. We can also control and prevent further COVID-19 infections and spread. This is through having actual sound logic and by following protocols set out by health organizations, by hand washing, by disrupting the chain of transmission and isolating infected individuals, which is key, as SARS-CoV-2 is often transmitted through respiratory droplets, and thus by the same logic we can then also prevent further spread by wearing masks and social distancing. Obviously, however, different strategies will be appropriate for different situations, and strategies may also be updated if the science is updated. Although no approved cure or treatment is available currently, the hopeful current therapies that are being investigated against SARS-CoV-2 are within the categories of cell-based therapies, biological treatments, and drugs, and of course in terms of preventative treatments, vaccines.